Thank you for joining us for today's Community Telephone Town Hall. My name is Zoelle Stackhouse, and I am the Special Assistant to the Deputy Chief of Staff of Mayor Muriel Bowser. We want to note that on Monday, the mayor announced that restrictions on public and commercial activities, not including bars, nightclubs, large sporting events, and entertainment venues, will be lifted on May 21st. On June 11th, capacity limits and restrictions will be lifted on those venues that cannot fully reopen on May 21st. Please visit coronavirus.dc.gov to review the most up-to-date guidances. Today, we are once again joined by the Chancellor of DC Public Schools, Dr. Louis Farabee, who will be providing an update on the reopening of DC Public Schools. Before we get started, I would like to remind everyone that if you would like to ask a question at any time during the call, please press 0 and you will be added into our speaker queue. And now I would like to pass it over to the Chancellor, Dr. Farabee.
Good evening. Thank you for joining us this evening to chat about public schools, specifically DCPS, for the 2021-22 school year. This will be our best school year ever, and tonight we're going to share a little bit more about some of our plans, particularly around health and safety, the way that we're thinking about ensuring our students have the appropriate learning environment as we approach the summer and August 30th when school starts. But today is a very special day, and I want to begin by recognizing our school nurses. Today is National School Nurse Day. We're extremely grateful for the service of our school nurses. Over the last 15 months, they've been phenomenal and essential to all of our operations for health and safety and ensuring that our students are prepared to go into the classroom and learn. And we know that they're a part not only of our health and safety, but the wellness and also the academic success of our students. So their work is so essential, and they've been incredible throughout this health emergency. And we're really grateful for the service of our school nurses. So again, thank you to all of our school nurses. Tonight, I have the pleasure to be joined by 3 experts that will provide additional context on the DCPS planning as we think about health and safety. So I am joined by our operations officer, and that is Patrick Davis. He's on the DCPS team. And then we also have from the WMATA team, Teresa Impostado, who is the executive vice president and the chief safety officer. And then we also have from the Office of the State Superintendent of Education, Dr. Heidi Schumacher, who leads all things health and wellness and also is a pediatrician. So again, welcome Teresa, Patrick, and Dr. Schumacher to tonight's discussion. As we go into tonight's discussion, I just want to emphasize our planning for next school year. As you've heard from me and also from Mayor Bowser, we are planning for a full reopening for fall for next school year, which includes full-time, 5 days a week for all of our students, and also continuing many of our health and safety protocols, some of which you'll hear about today. We're also planning for additional supports for students throughout the summer and ensuring that we start the school year strong on August 30th. Also a reminder, families, that this is also enrollment season to enroll your student if you haven't also done already and complete our re-enrollment process. As we think about our next school year and how we're supporting students for academic and social emotional success, we are now planning for how we will allocate our additional federal funds that we're receiving as a part of the American Recovery Plan. DC Public Schools is very fortunate to receive $191 million as a part of this recovery effort. We've already allocated some of those funds to schools to support our summer acceleration activities and also some of the social emotional activities that schools will be offering over the summer. In addition to that, we're stabilizing school budgets where we may have seen decreases in enrollment to ensure that schools have all the staffing and supports needed for next school year. So we're asking you to help us with additional thoughts around how we would best support schools. So we're asking for your ideas. For example, we've been providing some supports to schools to ensure we have our asymptomatic and symptomatic testing protocol. We've been providing resources to schools for social emotional development for staff and for students. And so we want you to give us more ideas of what would be helpful for your students and our families as we approach the summer and the school year. We are also planning a number of engagement sessions to help with this engagement process and gathering more input and feedback from you. So we are providing families the opportunity to participate in listening sessions. We also have building videos and tours that we'll be providing to families in the community so they can see some of the health and safety protocols and measures that we have in our buildings. And then we'll continue to have conversations like this with our experts and professionals. We'll also continue to lean on our recovery community core teams. They have designed many of our summer activities for students. For example, we have schools like Blue that are offering Microsoft certification training for students. We have, for example, Deal Middle School. They have Fit and Lit, which is opportunity for students to engage in literacy circles while also participating in physical activities. So there are a number of creative ways that the Recovery Community Core teams have worked with their school communities to design very unique and customized experiences for students over the summer. So with that, I want to remind you that now is the time to register for summer activities. So you can go to our website and register for activities that are centralized based, and then we also have our school-based activities where schools will be reaching out to families directly. Many of these activities will begin right after the school year closes, and the activities start in July and will go into August. We also have our summer bridge activities for students to get to know their school environment and also their peers and staff, and they can do that a few weeks before school starts. And then we'll also be requiring students to participate in our credit recovery activities for those students needing credits towards their graduation. So lots for students to do over the summer. We are encouraging families to register for those seats as much as possible. And then we have up to 19,000 student capacity for our summer programming. So at this time, it's my pleasure to turn it over to Patrick Davis, who's going to share a little bit more around how we are prioritizing health and safety and what our protocols are now and the way that we're thinking about next school year.
Great. Thanks a lot, Chancellor, and thank you all for joining us. Excited to be here again. So as we've talked about previously, if you've joined these town halls, at DCPS we viewed our operational planning as implementing the health guidance. You'll hear from Dr. Schumacher later, and we work closely with our colleagues at DC Health. But we're starting to plan for next school year. As the Chancellor mentioned, we're excited to have students back, but we're going to do it in a very safe way. We spent the past year learning about the virus and thinking about how to operate a school, and I think we've really proven that we can do it well through this past school year, and we're excited to build on that for next school year. So I'll touch on a few of the highlights we're thinking about for next school year, and then we'll touch on some additional things as well. First, we will continue to provide PPE and all the necessary hygiene supplies for all of our staff and students. We've done that through this year, and we'll continue through that through next school year and through the summer as well to ensure that everybody has access to masks and necessary cleaning supplies throughout the entire day. We're going to continue our cleaning protocols through next school year. We'll complete a complete deep clean of the buildings this summer, but once school starts, we'll continue the enhanced cleaning, again focusing on high-touch areas throughout the building. Next, we'll continue to focus on our classroom setup. While we'll have more kids in our classes, and we're excited about that, we'll still make sure our classrooms are set up in a way to reduce close interactions between kids. We've obviously posted signage across our buildings over the past year, and we'll continue that. Just to remind all of our students and staff about the importance of remaining socially distant and wearing masks and all the cleaning protocols. We'll continue that reinforcement through next school year as well. We've talked a lot in the past about our HVAC enhancements, and we're continuing that effort. So we invested $24 million through this year, thanks to Mayor Bowser and the Chancellor's support, to upgrade all of our buildings and make sure there's proper ventilation and filtration. We will continue that. So we'll continue the monitoring of air quality, continuing filter changes per manufacturer recommendations. So we will continue that investment and commitment to air quality in our buildings. Next, anyone that's been to our schools, you've noticed that water is a little bit different. We've talked in the past about water fountains being a place where germs can easily be spread. We will continue to have water fountains turned off and provide bottled water and water fillers throughout the school building. And next, we'll continue to work with our partners at DGS to prioritize our plumbing work orders to ensure that schools have access to the necessary hand washing stations and bathrooms to ensure we're able to maintain and continue our hygiene habits that we've built this school year. Next slide. As the Chancellor mentioned, we're planning on a number of different outreach events with families to share this. And as we've been reflecting about the past year, one of the things that we've acknowledged and recognized is that many of our families have not been in our buildings for the past year. They've trusted us through events like this. But one of the things that we're hoping to do and planning on doing with our schools is setting up tours for families to come and see the environment themselves. Obviously, a lot of work and planning is happening at the school level, and pictures are one thing, and we'll continue to provide pictures and videos, but getting into the building and actually seeing the work itself and see how the school operates is really the next step, and I think will be a tool for us to show our families how much we're invested in this and keeping our students and staff safe. So more to come on that, and we'll be working directly with our school leaders to set up individual school tours so that families have access to walk and see our buildings before next school year. I touched on this a little bit in the previous two slides, but just to reiterate some of the continual work that we'll be doing. I mentioned the HVAC enhancement. Again, we've been recognized nationally for our HVAC program, and we're relying on the guidance of third-party mechanical engineers and the ASHRAE task force on what we implemented. We are retaining the services of the engineering firm and actually monitoring all of our air quality in all of our buildings to make sure that the air quality meets the necessary standards for a healthy learning environment. So we'll continue that work. We'll continue the filter replacement per manufacturer recommendations, and we're looking forward to doing that. Next, we will continue the regular, as I mentioned, the regular cleaning. So we've really focused on high-touch areas. We've given dedicated training to our custodial staff. We will do additional training with our custodial crews this past school year. I do want to take a moment to just thank all of our custodial crews who have been working around the clock and have not stopped since the pandemic started. They've been working to make sure all of our buildings are clean and healthy, and anyone that's been in our buildings, you can see the work that they've done. Our buildings just look fantastic, and once families get in there to get a tour, they'll really see the work that the teams have done, and we couldn't be more appreciative of the team. And then next, as I mentioned, we're going to continue the procurement and delivery of PPE. So all of our schools have a robust supply of PPE, ranging from face masks to gowns and gloves for staff members that may be in close contact with students. We will continue that effort and making sure that all of our schools have the necessary supplies. Students and staff are able to bring their own face mask, but we will always have enough supply for students that need it out the door. So I believe that's, yep. So I'm going to pass it to Teresa.
Thank you very much. It's my pleasure to be here and describe the actions that WMATA has taken to address the public health emergency. So WMATA's taken numerous steps with regard to safety and health precautions that we've put in place since the beginning of the pandemic. We've worked closely to follow the CDC guidance and to partner and collaborate with local public health leaders. We've had all of our processes reviewed by third parties in the academic community to assure that we're taking advantage of the latest advances in technology, as well as augmenting our tried and true cleaning and disinfection practices to really make sure that we're creating an environment that presents the lowest level of risk for our customers. On a daily basis at Metro, our trains, buses, and stations are cleaned and disinfected with an EPA-approved disinfectant shown to kill coronavirus. That involves hand mopping and wiping down of all high-touch surfaces, as well as augmentation with electrostatic foggers in areas that are not conducive to hand wiping. We also have a robust program that includes regular third-party deep cleaning and sanitation of our stations and equipment performed on a rotating basis. In the event that Metro receives a report of an individual that may be ill throughout our system, or a report of an individual who may have been infected with COVID-19, we have the capacity for immediate disinfection, both on a spot basis with our equipment, as well as on a facility basis. So we have a mature process for responsive cleaning in the event that we receive any reports. Additionally, our buses have all been equipped with bus operator shields that provide a physical barrier that separates our bus operators from our customers. Next slide, please. Where we are today with regard to our approach progressing through managed reentry and entering the recovery phases, as vaccination becomes more widely available and a larger percentage of the population becomes vaccinated and we begin restoration of service and return to normal economic activity, we are working to upgrade our service. We want to make sure that we have enough buses and trains in operation to provide the levels of service that still comport with appropriate social distancing requirements and be on the leading edge in advance of the need for additional service. We anticipate continuing to add frequencies to our bus and rail system as we move into the recovery phases. We've also implemented some real-time data tracking with regard to crowding, and we maintain the capacity to add in additional service should we receive any reports or indications that we have crowding throughout the system. Next slide. So I'd like to talk a little bit about some of the activities that we've undertaken with regard to pilot projects, in addition to PPE and supply distribution throughout the metro system. We have invested significantly in air filtration pilot projects. I'll detail some of those in the upcoming slides. But we have been working actively with leading academic institutions as well as the federal government for research and design projects to enhance the cleaning and airflow exchange within our air filtration system. We have the aforementioned proactive and responsive cleaning protocols, as well as facial coverings located throughout the metro system. In any of our stations and on board our buses, we have free, readily accessible to our customers, individually wrapped facial coverings for their use. To date, we've given out over 100,000 facial coverings on our bus system, and we are equipped to continue doing so on an ongoing basis. We do have hand sanitizer stations throughout all of our fixed facilities at our bus depots as well as our rail stations. Additionally, we do maintain the capacity for real-time crowding information. On our buses, we use the target system in our fare collection to note how many seats are occupied and have the ability to show folks in real time through our bus ETA tool whether or not there are projected available seats in a red, yellow, green format. With regard to the metro workforce, we have regular mobile testing events for our workforce. Our workforce is available to avail themselves of COVID-19 testing in approximately every 2-week cycles, which comports with the infection cycle. We also have a very active vaccine coordination program with our staff. As many of you know, we have cooperated with the Federal Emergency Management Agency to have a FEMA community vaccination site at one of our stations. And we've been able to not only support the communities, but also get availability of the vaccine throughout the metro workforce. We've also distributed millions of facial coverings to the metro workforce for their ongoing usage. We are remaining compliant with the federal facial covering mandates that were recently extended by the government. So all transportation throughout the metro system does require the use of facial covering, including occupying our stations, our bus stops, as well as on board our moving equipment. All of the metro police are equipped with additional spare face coverings. So in the event that we find a report of noncompliance, they can provide a calm intervention and offer folks the opportunity to utilize facial covering that Metro will provide. We are complying with the TSA requirements with regard to reporting and have found for the most part that our customer base is fairly compliant when they are presented with the opportunity to don a facial covering should they not have one of their own. We do have regular ongoing checks throughout the system that monitor for facial covering compliance, and we publish regular metrics within our police department to target any type of enforcement activities if we detect any concerns or issues on specific segments of our service. Next slide. With regard to ventilation and filtration, I know that's something that has been at the forefront of everyone's mind recently. Metro rail cars all complete a full air change about every 3 minutes. So 100% of the air in a Metro car is recycled every 3 minutes. There is continuous fresh air intake throughout the operation of the Metro rail fleet. We've upgraded our filter system to MERV 9 filters and are piloting MERV 13 filters augmented by a UVC sanitation system that's supported by the FTA grant that I spoke of earlier. Our stations and facilities have all been upgraded to MERV 13 filters. We are piloting the use of MERV 15 filters and additionally do have continuous fresh air intake in our stations and facilities. On our buses, new air is continuously intaken via vents in the front of the bus, as well as when the doors open and close at each stop. The complete air change cycle on our buses exceeds that of our rail cars, approximately 2 to 3 minutes, for 100% of the air inside a Metro bus to be replenished with fresh air. We've also upgraded to MERV 7 filters and are working with the original equipment vendor to move to a MERV 10 as soon as possible, while also piloting additional air purification enhancements. We're piloting 2 systems that offer UVC sanitization options. We are following the guidance very, very closely, working with ASHRAE, working with the original equipment manufacturers to increase the filtration levels and the airflow further, and to continue to require facial coverings throughout the Metro system. And with that, I will pass to Dr. Schumacher.
Thank you very much, Teresa, and thank you so much, Chancellor and Chief Davis, for the opportunity to join today. I'm pleased to speak on several health and safety updates on behalf of the city. So first and foremost, as folks will see in my first slide, we have seen throughout this pandemic that layered mitigation or protective strategies are really critical to best support our school, the health and well-being of our school communities and our broader community. And as you'll see here, some of those strategies include many things where we welcome families' support in your personal setting too. So getting vaccinated, I hope that folks will continue to join the many, many, many district residents who have been vaccinated across the city, and I'll speak later in my presentation on opportunities to do so. Certainly in our school communities, all individuals are wearing masks on all aspects of school grounds and in all school activities. We encourage folks to continue to do so in the community as well. And of course, practicing good hygiene and staying home and getting tested for individuals who feel sick remains a critical risk mitigation strategy. On the next slide, I'll walk through some of the updates in terms of how district residents can access the COVID-19 vaccine. So earlier this month, the district transitioned to 11 high-volume vaccine walk-up vaccination sites. Those sites do not require an appointment. Anyone age 16 or older who is a district resident may walk up and access the vaccine. Children's National is also vaccinating individuals who are 16 and 17, and folks may have seen actually just today, the Centers for Disease Control approved the use of the Pfizer vaccine in individuals down to the age of 12, and we anticipate releasing additional information for district residents down to that age for how your young people can get vaccinated as well, which is very exciting. Next slide. I'll also remind that the COVID-19 vaccine is not the only vaccine that is critical for our young people. So as a reminder, there are lots of routine pediatric vaccinations that are critical to protect the health and well-being of our young people and our broader community. Immunizations are indeed required for in-person attendance. These are the routine pediatric immunizations. And ensuring your child receives all age-appropriate vaccinations is one of the most important things that we can do as a community to protect our children and to protect one another. Students without documentation of the full complement of required pediatric vaccines will not be admitted to school, and we encourage families to take action now. Please call your child's doctor now and make an appointment to ensure your child is up to date on all required age-appropriate vaccines. Next slide. And then we will continue as a city to work with our partners, our leaders at the DC Health, regarding health and safety guidance for schools that are anchored in the 5 key strategies recommended by the CDC. Those are articulated here: universal and correct use of masks, physical distancing within the building, hand washing, respiratory etiquette, cleaning, and then ensuring that folks who are sick and who may become COVID positive, that those cases are reported to DC Health and that we are contact tracing appropriately. We will continue to follow DC Health's leadership and the science here and make sure that our schools are operating in adherence with the latest and the best recommendations from our public health experts. And with that, I will turn it back to you, Chancellor.
Thank you, Dr. Schumacher. Also, thank you to Teresa and Patrick for the updates. Hopefully, everyone has heard tonight how we're thinking about preparing for the school year, for health and safety, also transportation, and how we will utilize our federal recovery funds to ensure that our students have the necessary and appropriate resources to continue a path of progress. With that, we'll stop here for our Q&A session of this evening.
Thank you, Chancellor. So now as we move into our question and answer section of the program, I want to remind folks, if you're on the phone lines, you can press 0 now to be added into the speaker queue to ask your question. Or if you're joining us via social media, you can comment your question on our Facebook or Twitter live streams using the hashtag DCHope. So our first question is going to go to the phone lines. Forgive me if I pronounce your name incorrectly. Ioana, in Ward 1, your line is unmuted.
Thank you so much for putting this together. We really, really appreciate it. I have 2 questions. When the COVID-19 vaccine will be made available to children younger than 12, will DCPS make the vaccine mandatory? That's my first question. And my second question is, the lunch break going to be continuing in classrooms, or are the children going to move to the cafeteria? Thank you so much.
Thank you so much for those questions. So we're excited that many of our residents have ramped up their participation in the vaccination process, and we anticipate DC Public School facilities being a place in which parents, guardians, children, everyone in the family can be vaccinated. We are not planning at this point in time requiring vaccinations for school participation. However, as Dr. Schumacher highlighted earlier, it's critical that families ensure that there's a clear immunization record for all of our students to participate in learning next school year. We will have a hybrid approach to lunch and breakfast next school year. We anticipate that many students will continue to have lunch or breakfast in a classroom, but there may be time periods in which we will utilize the traditional cafeteria space for meals.
Thank you, Chancellor. We have a question coming in from Twitter. The question is, how will the new restrictions being lifted impact schools for the remainder of the school year?
Yeah, we're excited about the recent trend in our cases. And again, as I mentioned earlier, the vaccination results in the city continue to be strong. As we all take the step forward of being vaccinated and continue to follow our health and safety protocol, we can begin to resume some of our activities that we're most familiar with prior to the health emergency. For DC Public Schools, we will continue to implement our current operating procedures, as you heard today. We'll continue our plans for celebrating our seniors and graduations. However, we will continue to monitor as we get more information from DC Health on what the new expectations and standards will mean for schools following the May 21st time period.
Thank you, Chancellor. Our next question is going back on the phones. Katerina in Ward 3, your line is unmuted.
Hi, I have 2 questions. The first one is, how are you planning on fitting all the students in the classrooms? Because under current 3-foot distancing, it seems that the average DCPS physical classrooms can only fit 15 students, but most classes under normal circumstances are 20 plus students. And then my other question is, are you going to be removing the cohorting rule that says that teachers and staff can't interact with more than 2 cohorts? because I don't see how high schools and middle schools can operate if that continues to exist. Thank you.
Yeah, thank you for those questions. Again, I'm pleased that we continue to see positive trends in our health metrics around the city, which allows us to provide different flexibilities for schools around cohorting and also spatial distance. As we have throughout this school year, we have made some modifications to our DCPS policies for cohorting. We anticipate that that will continue on a path for allowing us to serve all of our students in person next school year. In terms of spatial distance, we strive for maximum spatial distance within our classroom and are undergoing a school-by-school analysis of their space and how we will utilize space for the upcoming school year.
Great, thank you, Chancellor. Along those lines, we have a question from a LaSalle parent who is interested in knowing whether or not there will be pictures or videos provided on what the schools look like and how they're going to be set up in the fall, as well as what the cleaning and safety protocols are going to look like once all students are back in the classroom.
Yes, yes, and yes. So there will continue to be opportunities for families to tour school buildings. We will be providing additional videos to families on our protocols and what the facilities will look like in terms of logistics for full operations. That is underway, and many of our schools are already starting to have those conversations with families. We also will be calling on our students and parents and guardians to be ambassadors, to share more information about their experiences with other students or parents and guardians as we enter into the summer season. So to highlight some of that, I'm going to turn it over to Chief Davis. I know we've taken a couple questions about operations. I think he can provide some additional context of how DCPS is planning.
Yeah, thanks, Chancellor. As I mentioned during the slides, we're really excited to open our doors a little more than we have over the past year, and we're excited, as the Chancellor mentioned, to welcome families into our buildings through some tours. So during those tours, families will get to walk and see what the protocols will be. They'll actually get to see what it's like in a classroom. You know, pictures are certainly one thing, and we'll continue to do those, but actually being in the school and feeling the school environment will give parents and guardians certainly another layer of comfort. So we're excited to do that, and we're going to be working directly with our schools who will be scheduling those, and there'll be school-specific tours. But as the Chancellor mentioned, we'll continue to post pictures and guidance documents online. But one of the big things we plan on doing over the next few weeks and months is really opening the doors so families can get in and see those environments.
Thank you, Patrick. Our next question is going to go to Chris Myers in Ward 1. Chris, your line is unmuted. Chris, can you hear us on the phone line?
Yes, sorry about that. Hi, Chris Myers, Ward 1. On the 23rd of April, I attended a Zoom meeting that was put together by MedStar. And they had a guest speaker, Dr. Mark Johnson with Howard University. And I phrased to him, as a parent of a child who is under the age of 16, and now the vaccination age has changed to 12, how am I supposed to be handling this with a child that's not ready to go back to school? He's saying that he's uncomfortable. And the doctor literally told us that if he was one of our a parent in our position, he'd quite frankly be scared and doesn't understand some of the changes that are occurring with this. So I guess my question would be, for the students that aren't ready to go back to school and are having a much more difficult time, is there going to be any other type of option that will be left open for remote learning, or is it all going to eventually be back into in-person?
Yeah, thank you for that question. We're excited is underway to support all of our students in person. We also understand that there may be a need to have a limited virtual experience for some students based on unique circumstances. We have heard that from the mayor, and you're hearing that again from me, that there will be some type of limited offering. We will share more in the coming weeks of what that will mean for students and families as we prepare for next school year.
Thank you, Chancellor. We have a question coming from social media asking what kinds of programs are going to be available through the summer for students who would like some sort of in-person touch points during the summer?
Yeah, thank you again. Schools are communicating now all the offerings that are being available. It looks different at each school based on their school environment. So I encourage you to go to our DCPS Reopen Strong website. It will also give you links to information on our summer offerings. Schools have worked really hard to find a balance between academic support, social emotional supports, and also physical activity that would allow students to interact with their peers and also adults that they would see in the coming school year. I know many schools are also providing what I call the summer bridge experience. That is especially important for those students who have not been on a campus, so you may be new to your middle school or new to your high school. This is the first time you're going to your elementary school. It's a great opportunity for students to get familiar with the building and also all of the adults there. There will also be opportunities for students to earn credit, as I mentioned earlier. We also have a focus on literacy and accelerating math. So please go to our website and you can see what's being offered and register accordingly.
All right, so the next question is going to go to Tiara Zillman in Ward 6. Tiara, your line is unmuted.
Hi. Actually, my question, I believe, has been answered. It was about the virtual learning. But let me ask this question. What is in place for our toddlers, the early birds that are very germy? Are teachers' aides going to be put into classrooms like more to help out the teachers, to assist with the kids keeping on their mask and, not touching everything?
Yeah, thank you for that question. Actually, our toddlers in our infant toddler program and our early child education programs for our 3-year-old, 4-year-olds, we see great compliance from students in our health and safety protocols. They have been very compliant with the mask wearing and other cleaning protocols that we've asked students to participate in at those age levels. What's also fascinating is that we have new protocols for the hands-on experience that students have. So it would be unusual if you go into a class for 3-year-olds that each student has their own set of manipulatives that are specific to them. There are also cleaning protocols for, let's say, blocks or books that students may be handling throughout the day. And yes, we do have instructional aides in the classroom that support these efforts, and it's something that we monitor closely and to ensure there's appropriate staffing to support our youngest learners.
All right, we have a question coming from social media. One parent is wanting to know whether or not religious exemptions are going to be acknowledged regarding the COVID-19 vaccination.
Yeah, so again, COVID-19 vaccination right now is a choice for students and families. We are highly encouraging it because it does provide an additional layer of protection for students and staff. We will be providing space within schools for students and staff to be vaccinated. And as Dr. Schumacher highlighted tonight, there are multiple walk-up stations throughout the city where people can go and get vaccinated without an appointment.
Thank you, Chancellor. We're going to take just a couple of more questions because we're running a little low on time, but we want to encourage folks to continue engaging with us on social media, tweet us using the hashtag DCHope, as well as going on to coronavirus.dc.gov for the most up-to-date guidances. Our next question is going to the phones. Adrian in Ward 6, your line is unmuted.
Hi, this is Adrienne in Ward 6, and we have a kindergartner rising to be a first grader, and I'm curious about aftercare opportunities and plans that are being made with the city, because we're certainly excited for her to go back to school, but without aftercare opportunities, it's nearly impossible for our family to manage. Thank you.
Thank you for lifting up that question. It's an important one for families that are thinking about how they can experience a full workday without making transitions for before and after school care. So the good news is that we will be providing before and after school care as we've done previously, and we're currently working with our partners who provide that service to ensure that we're able to stand that up for the 21-22 school year.
Thank you, Chancellor. And our final question is going to go to Yuri Blazier in Ward 3. Yuri, your line is unmuted.
All right, thank you. My name is Jerry Blazer, Ward 3. Just curious, the level of commitment and kind of, is there a guarantee that kiddos will be going back to school 5 days a week, full time, between, the mayor's office, DCPS, and the teachers union? Has that all been worked out, and is that a full go at this point?
Yeah, we continue to plan for a full opening for next school year. If you had asked me, 2 years ago, would we have the health emergency and the COVID-19 pandemic, none of us would have predicted that. And so I do think there is some uncertainty always in terms of what will happen in terms of our health conditions and our environment. But we are on a strong path, and I believe confidently we'll continue on this strong path. And the expectation is that we will have our schools on a full-time operating status. We have staffed our schools accordingly. We're providing the resources, and as you heard tonight, we have the health and safety protocols to provide that. So there's a very strong commitment to providing that option for families as we go into next school year.
Thank you, Chancellor. That looks like we've gotten through all of the questions that we have this evening. Just want to remind folks that we'll be back here same time, 5 o'clock next week. So please join us there, and I'll turn it over to the Chancellor to give it his final word.
Yeah, thank you again to all the community members, parents, and guardians that asked questions tonight. I think it's important to note that we continue to provide in-person learning services to students right now. I know that we were not able to make as many modifications at the middle school to high school level because of the complexity of their schedules and the number of teachers that they see day in and day out. But we know that that can be a different experience for students next school year, and that is the way that we're planning right now. And we also want to be as strategic and intentional around our federal resources. So please join us for our listening sessions and engagement sessions around how to best utilize these resources, and please also participate in the survey that our community has received around giving us insight of what would be most helpful for our students. And then we're encouraging everyone to participate in the vaccination efforts across the city. If you want to see our students back in school, if you believe this is important, one of the most important things that we can do together collectively as a community is to get as many people vaccinated as possible. And as you heard tonight, we have a tremendous opportunity in the coming days and weeks to have our 12 to 15-year-olds vaccinated. Thank you.